Hi everyone, today I'm going to talk a little bit about maintenance care and what it is and how we utilise it in a clinic setting. So maintenance care is just looking after yourself in a much more long-term fashion. So everyone has normally had an acute episode of lower back pain, hence why they've come to see a chiropractor or an osteopath or a physiotherapist for that matter. So these people will often have had an acute episode. Well, maintenance care has now been proven, and we've now got some more research to suggest that actually regular treatments can prevent acute episodes of lower back pain. And so what we sort of try and encourage is for patients to kind of check up with us occasionally throughout the year. Now that period of time is often very individual to that patient. It mostly depends upon them and their jobs and their lifestyle, and also our professional opinion as well. So most of the time it comes down to, I don't know, sometimes between about sort of 3 and 4 months. Often some people like to come and see us sort of once every 6 to 8 weeks. And then we've got occasionally people who check up with us twice a year. And the idea behind it is to try and keep everything mobile, loose, flexible, so the joints are keeping a little bit more laxity in them, so they're not stiffening up quite so readily, and the muscles that surround and look after and support those joints are mobile, and they're flexible, and they're not inclined to get very, very tight, which can often happen with sustained periods of times in certain postures. So for instance, sitting, for example. Sitting is the primary thing that we now do, all of us, throughout our entirety of our day, whether it's in the car, whether it's at your desk, on the sofa, watching Coronation Street. You know, we all sit for a sustained period of time. So what we're trying to do is trying to encourage patients to not wait for that pain to get to a stage where it is acutely uncomfortable, but to try and help you prevent it getting to that stage. And you know, a lot of our patients come in and say, actually, I don't feel like I'm too sore, I'm too uncomfortable, but I feel a lot better now I've had treatment. And we find that so much with a lot of our patients. It's just a way in which we can try and provide a much more full, whole-round sort of service. You know, we don't like to treat patients in acute pain as much as patients like to be in acute pain. It's uncomfortable, and it's not very sort of pleasurable for the patient to go through that sort of, you know, rolling around on the bench and trying to get comfortable for us to do what we need to do to help them feel better. So for us, it works, and we know that it works. We see patients all the time, and the majority of our daily patient lists are made up of patients returning on maintenance care just to look after themselves. So don't delay, get yourself checked up, and make sure that you look after your back. See you soon.